skills, including the vocational training training centers even in rural areas, which can enable people who are out of school to go back and get skills that enable them to earn a living. However, the question is, as we are doing this, I think there have been a lot of challenges. So there's challenges around the quality of education and things like that. And those are the things now we need to seriously address. Having said that, and I think it's important to say one thing as we are talking about the improvements the country is making, one thing we have to keep in mind is we provided averages at the national level, but things are very different, even on that demographic transition across the country. Okay, so you find that while we were talking about that 3.4%, 3.4 children per woman average, there are parts of this country, there are counties which are where we were probably in 1979.
Oh, wow.
So the progress is uneven, and we have to pay attention to that. On the issue of employment for women, I think that I don't think we should overemphasize that data that says more women are in employment as such. It's also looking at the quality of the employment. So if you look at, there are more women in the informal sector and things like that. And so it's really getting into this data to understand what does this really mean when we say someone is doing better than the other. And last week, I think KNBS, they released some really good data on time use. The time use survey that was done in 2021, that if you look at, will help you have a better understanding of when we talk about people being engaged or employed, what does it really mean?
Exactly, a good clarification for my colleagues in the room. All right, let's move on to Dr. Kaoga, if we may, for a minute, because climate change obviously is top of mind for the entire globe, and Kenya is no different. Climate change has often been blamed on population growth, I believe. But data, as we saw, shows that half of all emissions come from the richest 10%, correct? And so a country like ours wouldn't be a major contributor, Africa contributing only negligibly. Therefore, what do you think is the right approach in dissecting the relationship between climate change and population growth responsibly?
Good morning, and thank you, Anne, for that question. If you look at the issues, climate change issues, these are cross-cutting issues. I'm saying this based on the fact that climate change is a very complex issue. Now, if we look at the long-term effects of climate change, they are very severe. And we need to take note of the fact that human activities are the major cause of climate change. Now, when I'm talking about human activities, I'm referring to the anthropogenic activities. These activities are mostly experienced, especially in the industrialized countries. And even as we try to achieve our industrialization, we realize that we utilize a lot of fossil-based fuel as source of energy. And this is emitting a lot of carbon dioxide into the atmosphere. Now, to put this into perspective, we contribute almost 50 billion tons of carbon dioxide to the atmosphere. And this is mostly because of human activities. And if you look at it critically again, you'll notice that only 10% of this is originating from 10% of the population. The rest, that is the rest of the population, 90%, find that they are not emitting as much as compared to this 10%. So that is a point of concern. But one thing which I also want to put across is the fact that Africa as a continent, this is in the global south. Africa as a continent is at the front line when it comes to the impacts of climate change, which is a reason for us to be concerned. Now, why is this? Yet Africa contributes very little amount of carbon dioxide and other greenhouse gases into the atmosphere. Why is this? This is a question which sometimes, if you reflect on it, it becomes very messy. Now, irrespective of the fact that we are the most vulnerable in terms of risks which are associated with climate change, especially the extreme events which are associated with climate change, how can we be able to come out of it? How can we come up with solutions? And this is where now the data plays a very important role. Actually, because for us in the research world, data means a lot. And data means information, and data also means knowledge. So based on this, we also need to appreciate the fact that if you look at the demographics, you realize that Africa has a young population, youth population. These are people who, if put through some task, can be able to accomplish a lot. But we need to also bring in some elements of modernization and also technology for us to be able to achieve this. So our youths should be exposed so that they can take advantage of the expansive land which is in Africa, for them to be able to convert that using modernization and technology into some useful output. And just to link population and climate, I wish to mention that whenever population increases, the demand for food also increases. And whenever the demand of food increases, people normally have that notion of expanding. How can we expand our farm area so that we can create more food? And this also affects the ecosystem in that it leads to degradation. And again, leads to increase in the global warming. So at the end of it, let us look forward to come up with solutions, especially solutions which are not random, but solutions which are long-term. And this can only be realized if, based on the evidence which we read, we create some policy. We create some policies which will be able to create solutions to our issues as Africa. And this should be extended to the rest of the world. Thank you so much.
Thank you, Dr. Maybe we'll circle back if we have time. Professor Mireri, welcome to the panel. Let me shift gears slightly with you. So how do the changing demographics then impact urban development and city planning? And I think that's a conversation for those of us in the room from Nairobi that has been coming up so often, the strain on planning and development, and in many cities around the world. So how does demographics impact the work of planners, and what is the government doing to be able to adapt to changes in the population?
Thank you very much for the question. It is my pleasure to participate in this forum on behalf of State Department for Housing and Urban Development. Yes, I think when we look at this issue of urbanization, demographics, urban development, they are quite related. Because for one, the only agreeable criteria for defining urban space is the population. So it is very important. Secondly, from the planning point of view, we plan for the people. Therefore, the data, the quality of the data that we have with respect to urban spaces becomes very critical in defining the demand for the population, the demand for services, and so on and so forth. And it is my great pleasure that I'm in this forum because we have had a lot of discussion. If somebody asks us today, what's the urban population? I'm sure that the director here will say approximately this figure, approximately this figure. But this convergence of idea is very important so that going forward, we need to have urban data for planning. We need to have urban data to know exactly, if I'm talking about this population, then based on planning standards, I'm able to determine the demand for various goods and services. But without that, it becomes a very big challenge. Coming to what the government is doing, I must say that there has been an engagement between State Department and the National Bureau of Statistics to get, first of all, to deal with the issue of defining what is the urban space, delineation of boundaries. It is one of our key objectives, and this will be pursued so that in collaboration with the county governments, we can fully confirm that this is the urban space. And thereafter get data with respect to those spaces so that from that perspective then we are able to calculate exactly what is required. So that engagement is going on, and one of the priority areas is that the government is planning to work closely with the county government, because this is a devolved function, to, within the next few years, to accurately define the urban spaces, one. Secondly, the government is working towards revising the National Urban Development Policy. I'm sure that most of you may not be aware, but we have National Urban Development Policy for the country, which defines exactly what we're supposed to do. And I think during the next 2 years, we will be doing that, and we want to engage with the different arms of government to ensure that we infuse the ideas that we need going forward. The other key point that is also being worked on, and the government is working on this, is reviewing the Urban Areas and Cities Act to fully realign it to the development challenges of today. So that's going on, and within the next 2 years, this will be done, and we would expect that during the next population census, we'll want to have urban data, so that when you say the city of Nairobi has this population, then you are sure it is this population. If you are talking about my rural municipality or Ugis, that is the population, then you know that this is the population. But you don't have villages being included as towns. So from there, then we get clear picture of how we are moving forward. So the connection between population data and planning cannot be disputed. Without data, you cannot do any planning. But then the next level, which I think has been embraced by government since 2003, is moving towards integration, so that professionals from different levels sit together and out of that process get a plan that captures all the aspects, whether it's climate change, whether it is urban economy, whether it is environment, whether it is the youth issue. They should all be integrated. So I think that process is going on, and it has made good progress. All that we need to see is that continuous engagement. And I think, to me, that is very, very positive. The other key point to note is, and this is something that we need to encourage, I'm very happy that we have this data by the Kenya government. But if I ask now, what is the unemployment rate as per this data? You know, accurate unemployment rate, they're talking about unemployment of women, men, but what is unemployment? I think it is more acute than is being captured, according to me. You're talking about youth bulge, and then now nobody says, is it 14%, is it 20%? So I think we need that continuous improvement so that we have accurate data. Then we are able to say, how do we deal with these issues from the planning point of view? Because if you ask me, can you provide more spaces for this kind of economic activity, I can only do it if I have the data. If you tell me that you have this number of households in this area, I need more spaces in terms of accommodation, in terms of education, in terms of health. So the connectivity between what we are doing and what we are doing is quite critical.
Allow me, Professor, to hold you there. We may circle back. Let me hold you there, but I think critical data is the heart of the kind of work that you do. So thank you for that. Let me bring in Dr. Joan, if you would, sir, at this point. So the State of the World Population Report has emphasized, and often we do emphasize the need for universal access to sexual and reproductive health rights that includes affordable and quality contraceptives. Is there currently, in your opinion, sufficient support for women in terms of their reproductive agency? And what do you think we can do better to realize universal access?
Thank you, Anne. Thank you, Anne.
Thank you, Anne, for that question. So the generic answer to your question is a yes, but I want to qualify that as, because it's a yes to some extent. If you look at the yes and why we need to qualify it, I want to peg it on some data. Beginning of this year, there was the KDHS report that came out. That is the Kenya Demographic Health Survey report that came out. And within that report, there are very critical indicators that people in the development sector, especially those in health like us, look at. And some of the interesting things that came out was, number one, the percentage of unmet need has significantly gone down from 2014 to what we have right now. In 2014, it was at 18%. Right now, it's at 14%. We were also looking at what is the percentage of women who are married who are actually taking modern contraceptives. In 2014, we had about 53%. That has gone up to 57%. But also, as we were cycling on that, we were asking ourselves, what is the fertility rate looking like? And we saw a decline, a slight decline of about 5%. So the generic answer of yes, qualified, if I were to give it a rating, it would be 3.5 out of 5. And the reason why we want to say it's a yes, with room for improvement, is because of key things. Number one, we've looked at the enabling environment, where we are speaking about the legal and the policy framework. We've seen some improvements. We have the Kenya Health Act, we have the Kenya Health Policy that has been put in place. That gives us some level of enabling environment. We also have a very strong family planning program in Kenya, and I want to applaud the Minister of Health, working closely with the different partners. We've really strengthened that. And just to mention one thing that is currently happening, MSK through UNFPA and working closely with the Minister of Health is actually providing vasectomy and BTL services in government facilities, as we are talking right now, in Nairobi and Bungoma. Without a strong family planning program, that would have not been possible. We are also looking at the commitment, the financial commitment that the government has made in the past year. In the financial year of 2020-2021, the government only allocated 0.5 billion resources to family planning. In the subsequent year, we saw an increase, and the government subsequently allocated 0.8 billion to family planning. That is progress. It's not addressing the need, but we're saying, you know what, we're on the right trajectory. But also, as we applaud that progress, then we need to be very conscious of the geographical disparities that are coming with that, and also the lack of equity that is actually upholding that. And some of the key challenges that we still have is we have serious stockout in government facilities. And I hope Minister of Health is present in this function. Because if today you walked into a government facility seeking a family planning method, chances are whatever you'll get is not what you want. It is what is available. So your choice is actually limited to what is available. We also have seen constrained budgeting, especially if you go to the county level. The county level governments are not allocating as much resources to that. And that has been a huge hindrance to the kind of work that we've done. We're also seeing limited policy implementation, and I want to highlight one critical policy. We have the Adolescents and Youth Sexual Reproductive Health Policy, a policy that is so critical to us as a country because of our population continent, but a policy that we're not ratifying because of our own socio-cultural limitations. So if today a young person, let's say 17 years old, walked into a government facility seeking sexual reproductive health, their choices are limited. And you know why their choices are limited? Because the government is not providing clarity on the enactment of that policy. So that has become a huge hindrance. But also we have the education. You know, information is power. If you look at the kind of curriculum that we have, it's not providing an opportunity for comprehensive, age-appropriate, and I want to underline age-appropriate because most of us are parents. We are concerned about the kind of information that our young people consume. But if we ensure that there's comprehensive, age-appropriate, sexual reproductive health information to young people and everyone within the schools and community, then we'll ensure that they have the right information to enable them make the right choices. And I know the last bit of your question you asked, so what next if we really want to change this? To me, the ask is, we need to make more investments, and I hope the government is represented in the room. Let's invest in family planning. Let's put the resources out there, both at the national and the county level. But also, the academicians in the room, let's ensure that we have the right curriculum within our schools and also within the communities, so that the right information is available at all facets of the government. But also, we want to encourage other stakeholders. Let's invest in capacity building of our health workers. We have a robust health work continent, but we're not investing in them because we say we are limited in resources, we don't have this cannot happen. But if we were to invest in them, then we'll see a scale in the kind of indicator reference that we want to be seeing in the future. So to me, that is what I think we can do for the time being, and I'm hoping that together as partners, as stakeholders within the space, we can actually put our heads together and buy into this and invest on it.
Brilliant insights from our panel. A round of applause for all of them. Listeners, now, thank you. You may make your way off stage. Thank you so much. So with that perspective, allow me to reintroduce now the Director General of the NCPD, Dr. Sheikh Mohammed, to guide the next session.